Oh, well, let's see. Accept. Sir, good day to you. Wow. Why is this shit never let anyone join? Let's see here. Come on.
Oh, wait.
There.
I've never done a live before, so this is trial and error.
Nah, well, you're in now, so you don't really have to do anything. You just have
Oh,
to,
good.
no, just look at the camera
Yeehaw.
and you're good to go.
Perfect.
Cool. So we'll give it a couple minutes here. Let's see, let a couple more people jump in. What did they say? We deserve a Halloween costume on this live. Huh?
Yeah,
I
what are
am
you dressing
I'm a
as?
skeleton. I'm a skeleton for Halloween.
How are you
Yeah.
feeling?
It's funny, you're like the fifth person that's asked me that today.
I mean,
Um,
that's the only
it's
question
a
that's
weird, it's a weird question 5 days out from a show when you're like on no food.
oh, yeah.
So the default answer is like really bad.
Terrible.
Yeah, not good, but nah, it's all right. So, um, yeah, newbie. And so there's a newbie. Yep. Um, okay. So we're gonna do something a little different for you guys today. And if somebody jumps in later on, I will repost this so everyone can get to see it. So we wanted to do kind of a live story slash client testimonial. This was an idea that I had because, of course, I like to post photos, post client progress, post testimonial videos, things like that. I thought it would be cool to actually get someone on and talk about their story and give us a little bit more backstory and talk about the process because um, that's really what I want to take away from today. Not necessarily the result, but the actual process. So before we get into any of that, why did you approach me in the first place? So talk about like what were your issues and what kind of like led you up to that point.
Wow, my
I
issues.
know it's a lot. I know it's a lot.
I don't
So
think there was an issue that I
give us
didn't.
a cliff note story.
Um, Pretty much, I had no control over my bowels whatsoever. As if that was probably the most one that was outstanding was I really had no control over when, if, and where I went to the bathroom. I had incredible amounts of pain in my abdomen, lots of gas, tons of bloating. And when you're somebody that's been with that for a really long time, it was really easy for me to see the water under my skin and how that would never go away. It was just like everything was wrong, pretty much. Like my mood was all over the place. My hormones, you could tell, were all over the place. There was just nothing regular in my life whatsoever. And I'd worked with a couple coaches previous, but when I think that Austin, I think that with your name and what you've done in the industry specifically, I think a lot of people know you, and you were definitely a top recommendation for me from really anybody that I reached out to when it came to functional health. Your name was thrown around with everybody. But I think that your results that you've given so far, I mean, what you post and just the knowledge that you have, I think is really admirable and definitely brought me to you first because I mean knowledge is obviously it's important to be knowledgeable on what you're doing, but I also appreciated the fact that we had a couple conversations before we agreed to really step into work together,
Right.
and we one of my favorite thing too I would say is that I really liked that you kind of set the standards of what we were going to do because I came to you so I don't know, so all over the place, my symptoms and mentally and physically. I think that was really huge in the beginning, was really setting the standard about like what we were trying to do, what could happen, what could not happen, where it could kind of go. That was really helpful for me to kind of set a starting point too. So that was
Right.
really cool.
Yeah, because I remember when you came in, you had specifically mentioned in your consult that the issues started around the age of 15 and then
Yeah.
obviously
Yeah.
came to a head much later with a lot of events, with pushing your body, as you will.
Mhm.
Um, so when I get a case like this, there's a lot of backstory to it. It's very in these chronic cases. There's also a lot of data. Generally, people have maybe tried to do something on their own, or they've worked with another coach before, or multiple, or whatever it might be. And in your case, having had run protocols already and done, really you had done all of the things on paper if we're looking at it. So to me, and I get a lot of these cases, right? They're
Mhm.
like, I've done the Sibo protocol, I've done the
Yeah.
Candida protocol, whatever it might be. So there's obviously some gaps. So like I have to figure out like what are these gaps? And
Mhm.
so when we came in, we had those discussions. If you remember, I'm sure you do, there were probably some things that I presented that were kind of like non-negotiables. I'm like, this is kind of, I was like, you've done this before. I'm like,
Yeah.
this isn't, so we maybe need to like not soften the approach too much and really talk about like, this is what has to be done
Yes.
when we come in because last thing I want to do is do the same thing that somebody else already did. And obviously, if it hadn't worked, then we're kind of spinning our wheels. But
Right.
yeah, so that was our intake process. I remember very
Mhm.
distinctly. And
Well, that's what I was afraid of too, because I
right,
remember that I told you I was like, that's what
correct,
I think I was really hesitant about too in signing on with another coach for another protocol. I was like, I've done all the protocols before, so I was
right,
very hesitant to say like, yes, let's do this because I'm like, something has to be different. Something has to speak to me that like this is going to be different. It's not going to be the same thing.
right. Yeah,
Yeah.
and that's something that in like a lot of the coaches that I work with is like fine tuning that actual delivery
Mhm.
versus just the protocol. Because I mean, anyone can learn the Sibo protocol at the end of the day in today's day and age. Like anyone can learn it, memorize it.
Yeah.
So that's kind of how that intake process went, as I recall. And there were there were a lot of like sub conversations at the beginning. They've become a lot less because you really turned a corner. There was like a point, and this is so cool when it happens. There's like a point when people buy in fully and they fully just kind of come to terms with what the process is.
Mhm.
And when that happened, I remember our conversations changed a lot. And all of a sudden, symptomatically and progress wise, there was some huge differences. So was
Yeah.
there a was were there conversations or things that we talked about that you maybe hadn't thought of or weren't fully acknowledging that was maybe holding you back in prior attempts?
Oh, I can tell you right now. Like I literally remember when it was is when you kind of yelled at me. You kind of gave me a little bit of the firm hand and you were like because in previous experiences that I had um other coaches wanted me to report every little symptom change that might have happened. So like if I got like, if I didn't have acne before in my gut case and now I was seeing acne, like I was supposed to report that. And so I think I was so hyper aware and hyper focused on all those little tiny changes that it was stopping my progress altogether because I was so obsessed with all those little things. And I remember there was a point where you were like, stop with all of the like, I don't need to know every single thing that changes. Symptoms are going to come and go. I need to look at trends, which I knew. I don't
Sure.
know how to describe it. I think it was just really the way that you put things into perspective for me, or the way that you just described them to me. They just like clicked in my brain. And you definitely took the time to like explain what's necessary and what's not. And I don't know. Like I
Yeah.
remember that conversation specifically. I was like, oh, I got it.
Right. Yeah. Someone asked, will this be saved? Yes, I'll repost it on my page and then I'll put it on my YouTube as well. So it'll be there. Yeah. So That's a really great point. And that's a common turning point for a lot of similar cases is like learning the value of data collection and what data collection is good and what data collection maybe isn't. I don't want to say bad because bad's not the word, is
Right.
what makes sense for you at that point in time. So for some people, that may be tracking several different variables. For other people, it may be like a lot less tracking, a lot less biofeedback tracking. So it really depends on the person, depends on the case. But what I find in most cases like this is it's not an adherence issue with
Yeah.
people. It's not like they can't follow a plan. You can follow a plan. It's not like you can't track data. You can track data. It's not like I'm chasing you for things. You can do all those things. And you can do it to a really high degree, but is it helping? That's the
Yeah.
question, right? That's the question we have to ask. Like, is it helping? So when I see things like, and I'm not saying this is your case, but when I see things like a gut protocol case that goes on vacation and doesn't follow the plan, and then when they get back from vacation, they have no symptoms, that's
Yeah.
telling you something, right?
Right.
So so that's kind of where I think that when you figured that out, it was like bam,
Oh
all of
yeah.
a sudden things started to click.
Hmm.
So I also wanted to ask, as far as we covered the GI, hormonally though, were there other things in the background hormonally going on when you approached me as well?
Oh, stress. High
Yes.
stress. And it was definitely like everyone, I think that everybody in your life, and especially anybody in the bodybuilding industry, I think that we see it everywhere where it's like, you got to bring your stress load down. You're too stressed. You've got to be stressed less. But I don't think that there's really anything talking about what that means or, like it really was you putting it in perspective for me and being like, any kind of stress in the body is stress in the body. Like I never really understood that like training and being stressed out over like a job or whatever it may be, it like presents itself the same way in the body and it kind of does the same thing. And I didn't realize that. So I knew if I didn't feel good, I wasn't supposed to train, but I didn't realize that, maybe I had a really rough emotional day or I was really stressed out that day. And then I would go train later and the next day I would be like, felt like I was full of sand and I couldn't even walk. So it was really like understanding and putting into perspective what stress might look like in my life, and really addressing those situations, journaling, doing things that was like within myself and my mental that was able to kind of bring me back down and get me out of my own head, and stressing about my protocol constantly and like paying attention to my life and other aspects of it as opposed to just bodybuilding and being so obsessed with getting better, which I think with other coaches, me being so obsessed with the end result and being fixed and perfect, that was what really stopped me from getting better. I think that stood in my way a lot of times, for a long
Yeah.
time.
Yeah, absolutely. Also, so you talked about some of your symptoms too. So I know there was also issues with with yeast overgrowth and candida
Oh
issues
yeah.
and stuff.
Oh
Initially, that
yeah.
was like a really reoccurring thing.
Hmm.
So can you talk about symptomatically now? Because I know that what we've seen is you're mostly out of the woods, but like if we backslide, there's not quite the resilience there yet to handle
Yeah.
too much. We can
Yeah.
still backslide, but we're definitely on the back end of it.
Yes.
So as far as symptomatically, um, what improvements have you seen?
I honestly like you talk. This is good that we're doing this because you like representing my symptoms to me. Like I blacked that whole thing out.
Right.
Like I'm like what?
There was
Uh,
probably more. There's so few now that it's probably like you forgot about a lot of them
no,
earlier.
I had a yeast infection. I had a chronic yeast infection or a UTI for probably over a year. It
Just like
never went
nonstop recurring.
never
Yeah.
went away. And I kept going to my doctor and she would throw different antimicrobials, different antifungals, different antibiotics at me, all sorts of stuff. and they couldn't figure out, and they were alarmed at the fact that I could not get rid of my yeast infection, and they were doing all these tests, and to a point I honestly just stopped going to my doctor because she didn't know what to do, and she just kept throwing different medications at me, and I'm like, this is not, I can tell that she doesn't know what she's doing entirely, and she's trying to help, but it wasn't getting down to the point of the issue and the cause of it. And so there wasn't really anything helping because it was coming, from the gut whole thing. But yeah, no, it was constant yeast infections or a UTI for over a year. And then kind of like my sex drive and everything, that completely went to nothing. I had no periods. I had pretty much nothing reproductive wise whatsoever. Just constant infections, really. And now since then, I haven't had a yeast infection in quite some time, but even if it wasn't an infection, like there was some kind of something going on down there for at least over a year. So that's since ceased, thankfully.
Yeah, knock on wood.
Yeah, with no treatment really either. I mean, it's been kind of crappy, just kind of having to put up with it and not really take any new medications. So I don't want to mess up what we're doing already. But it has since kind of ceased on its own. So
right. Yeah. So you had, again, kind of a typical thing that I see, long history of antibiotics, or at least a lot of antibiotic use in a short period of time. Right. So we know that that's another factor that's definitely going to smash that gut microbiome extremely bad. So of course, while it may kill an infection very temporarily, it's just a constant cycle. And then antifungals, so like diflucan, things like that coming in play as well. So there was a lot of, and a lot of these antibiotics too are systemic. So what happens is they kill an infection, but they're killing bacteria all over the body, which includes the gut, which includes the skin, which includes like on your skin level. So you're talking about things like acne. That's where a lot of people forget that when these issues start in the gut, eventually, as that gut becomes really permeable, the intestines become permeable, you now have issues all over, right? So you have brain fog, you have joint pain, you have skin issues. Women pay a lot more close attention to this than men, but hair, skin, nails, like all these things, everything, all of your connective tissue, all of those things are impacted. So there's a lot of like indirect things that get better over time.
My hair loss in the previous gut phase that I did before you was ridiculous. And I didn't even realize how bad it was until I started to get healthier. And I would take a shower and I would be like, oh, I didn't have half the hair fall out of my head. Like, this is more normal. But it became so normal because it kept happening that I didn't even know the difference.
Right. Yeah.
It was just intense.
Yep. So a lot of yeast especially is it's a bitch. Yeast, because you get a lot of fungus in the scalp. You can get a lot of fungus in obviously a lot of areas. And then in women, vaginal yeast infections present themselves. Men generally get more on the hair side, athlete's foots, things like that.
Well, I had facial symptoms too. I had like red rashes all over my face. I
remember.
I went to a dermatologist for that.
Yeah, so it almost looks like, and I see this in some people too, it almost looks like rosacea, the redness on the skin. But really, and people have no idea, so they'll go to their dermatologist. It's yeast. It's like yeast overgrowth. And some people get so bad that they'll get like patches all over their body, in different places. And it just happened to be on your face, which is really, not a great place to have it, if anywhere.
I cried and cried. It was so embarrassing.
One other thing I wanted to ask too was, and we can kind of wrap it up there. There was a psych component to this, which we talked about as far as, your mood, but they were also medicating you for that too. So how has your mood improved in general? So like when I say mood, stability of the mood, like ups and downs, and just an overall stability of the mood.
Sure. So I feel so much more in control of my mood, to the point where literally, what was it, last week, 2 weeks ago, I told you, I was like, hey, I'm on my last refill of my depression medication, which I didn't add in. I've been on fluoxetine, which is like Prozac, for
Yep.
my anxiety since I was about 2020, probably in college. And then they added the buprenorphine, I believe it was, or not buprenorphine, never mind. But
It was Wellbutrin,
yeah,
Wellbutrin,
that
which
was a
is, yeah,
veterinary term. That
generic.
was
Yeah,
a
yeah,
medical term. But they
yeah.
added in the Wellbutrin. It was in December, and I had of last year, so it was about a year ago. And I had competed in my first show and was absolutely wrecked internally. Was in October of that year, and then December I had depression symptoms. I'd never been depressed before that I had thought of, at least. And so they put me on the Wellbutrin in December, and it was about this last check-in that I was like, hey, I'm on my last refill. I don't have any more. I really don't think that I need it. My mood has been so incredibly stable. I'm keeping in the anxiety medication just because I've had anxiety and OCD. I've got OCD tendencies as well since I was younger. But the depression portion of it, the sadness and the constantly being down and gray and just can't get up in the morning, that kind of stuff has been completely gone for probably 2 or 3 months, I would say. Just getting up in the morning and like being able to put my best like positive foot forward has really been a game changer for me, and something that I saw a really big difference in. My boyfriend would attest to that as well. He would say that I'm definitely more
Yeah.
stable across the board.
Yeah, it's always easier for people around you because
Yeah,
it's like a less biased party. You know what I
exactly.
mean? Because they could be a little more objective with it. So I always love when a client's like, "Hey, my friends or my spouse or my significant other is like, you're in a lot better mood." Like, awesome.
I
So,
actually didn't even tell him that I came off the depression medication. I wanted to see if, he would say anything, kind of thing. And it's been 2 weeks and he hasn't said anything. I don't even think he knows. So that's pretty cool.
oh well, if he watches this, he'll know. He probably won't, but that's awesome. I love it. So, is there anything else? I mean, I think you summed everything up. I mean, it's incredible if you really think about. We just went through like 25 things, really,
Yeah.
and you're definitely, like I said, you're definitely on the back end of it in terms of creating that resilience. Now, like
Mhm.
really solidifying that resilience. Where ideally, what I want in a client success case is I want it to be, if you have a bad week, that it's not going to debilitate you for a month, because that's how our body is designed. Like we're designed to handle stress. So like we realistically should be able to have a couple bad days and be fine. Like
Right.
that's the point that we're getting to, where we're really building that resilience up. So is there anything else that you want to add?
No, I mean, I think that pretty much hits the nail on the head too. I mean, I think it was a couple weeks ago that I kind of had my parents came in town. That's what it was.
Yep.
And we had a weekend where I was like, "Hey, we're going to be eating out a lot more this weekend. We're going to be drinking." Like I was a little bit nervous, but I think I went into that weekend really prepared for the expectations for the weekend. I think that's the biggest thing, is setting expectations for myself, and that way I don't fall too short. But no, I mean we had a fun weekend. I didn't really stick too much to the diet. I stayed on my supplements, but other than that, diet and alcohol were definitely a little bit wonky that weekend. And still, I had very minimal backlash from it in terms of my body,
Yep.
which is unheard of. That normally would set me back for like 2 whole weeks. And the fact that I was pretty much fine on Monday when they left and not curled up in a ball in the middle of my bed in tons of pain
Right.
was huge.
Right. Yeah. Yeah. And I think a really great takeaway to end this is these processes don't have to be complicated. Okay. So that's a huge thing that I really try to get across to people right out of the gate is I'm a very easy person to work with overall. And that's one thing I try to reiterate to people is that this doesn't need to be, as it's a complex topic, but I think it's super important if you are a functional coach and working with these cases, is that you're able to simplify this process down to a point where you're not adding extra stress to the client.
Yeah.
Right.
Oh, and you're very good at that, because this has been so simple for me, and I can ask you questions and like the responses are detailed, but it's not, I don't feel overwhelmed or that I need to analyze any of my symptoms or anything
Right.
like that. I feel very, very comfortable. Like, you have a handle on it. You've got it. If something new arises that I feel is alarming or necessary to tell you, I will. But majority of the time, it's just coasting, keeping it calm, cool, and collected, getting the things done every day, getting in and getting out.
Yep. Somebody asked, we'll finish with this. So what did you do to fix it? Well, we talked about it throughout the video. So rewatch it. So honestly, a lot of what we did to fix it was not protocol related. A lot of it was environmental, psych, training. I guess that's protocol technically. Nutrition, a lot of those things.
The big one. Training was a big,
Yes.
because I was training differently through the last gut protocol, and this one
Yep.
really is all metabolically purposed. And do I miss the gym? Absolutely. I don't feel like I'm training like a bodybuilder, but like, we're not bodybuilding right now. We're fixing issues, so it's going to look a little different. So I think it's just really accepting what I'm doing.
Right. Yeah. Buy-in.
Yeah.
That's it. Yep. And just for clarification, like we are using, supplementation and things like that. So like there's a protocol component to it. It's just that we were able to, that protocol was 10 to 20% of the equation, where we were able to take that 80% that was missing and get it implemented. Not driving systemic stress. I mean, that's the biggest thing. Is I always tell people, if you can be stressed out 5 less times in your day, that's 35 times over the course of a week. And that is however many times over the course of a month and a year, and et cetera, et cetera. And there's where you start winning. So, awesome. I appreciate you making it on. Anyone that didn't catch the whole thing, I will repost it, and yeah, we'll keep on rolling. We're not done. We're getting there.
This is step one.
Yeah. Well, then we can get into fun stuff, right? Because then we can get into, and plus we have really established those habits. So now when we go to improve body composition, we're not going to end up right back where we were at again.
I'll tell you that too, is like, I was literally telling my boyfriend the other day in the gym, I said, babe, I've never, like, I hear people talk about pumps and I've seen pumps. I've never had a pump before until now, because my body
working.
Like, taking the nutrients.
You told me.
To the right spot.
You're like, I got a pump.
I'm like, this is what a pump is? This is so cool. Yeah, I had no idea.
Yeah.
I had no idea.
Awesome. Yeah, cool. Well, thanks for coming on. I really appreciate it. I hope you have a great rest of your day.
Yeah, you too. So I'll talk to you tomorrow.
Yep, we'll see you.
Bye.
Bye-bye.